Hello, everybody. I'm a little late today. It seems that has been the theme of today, just kind of running, and it was kind of a little bit of a weird day. Um, but here we are together one more night. I hope that you all had a great Halloween for those of you who celebrated, and for those of you who don't, I hope that today is being a very good day until now. So I usually like starting this with either a subject or, a case that might have happened during the week that is of interest. And so today I'm just going to briefly talk about a case of Ashmans. For those of you that don't know what that is, it is when there's adhesions inside the uterus and causes from mild issues to severe closing of the uterine cavity, that might provoke no periods at all. Ashmans, it's a little difficult, especially in severe cases, to fix. Not impossible, just a little challenging. And it seems that there was a joke when I was a resident that things comes in threes, and that has been the case in the last few months with Ashmans. I've had 3 cases in the last few months, and so I wanted to bring that up. It can be very frustrating for the patients that are dealing with this, especially the more severe cases, because every time you go in and clean these adhesions, they can just reform. So it could be very complicated. So why would you get something like that? So adhesions inside the uterus could be as a result of infection. They could be as a result of trauma to the uterus by any procedure in the uterus. And, and it could be induced by doing an endometrial ablation. I am presently working with a beautiful lady that had an endometrial ablation that was unfortunately very successful. And then, now she remarried, and she would like to have children with her present husband. So we are working on trying to heal her uterine cavity that has been a little challenging. We were able to open the cavity again and leave a balloon inside to create a new cavity, and give her high doses of estrogen to try to get that lining to heal. We did PRP. She's on different supplements, but unfortunately, it seems that some of those adhesions might have reformed. But okay. All right, so you have a question. I'm going to do my second transfer this month. I'm going to use an ACG wash, intralipids, and embryo glue. Do you think that's going to work for embryo stick? I'm 40. Yes. I had this discussion earlier today. IVF, it's 50% chance of success. So it's 50% good, 50% not good. Sometimes we tweak it a little bit. So I do hope that, this is the 50%, the half of the glass being full for you. Okay. So going back to the Asherman syndrome thing. So a lot of times these patients, they go through multiple hysteroscopies to try to, keep the uterus open. Those that are successful, they have better chance of resolution once they go through pregnancy, just because of the stretching and all of the hormone changes that happen with pregnancy. It seems that if they are able to get that uterus to stay open after, in order to get pregnant, and then the pregnancy itself might be healing to the uterus, permanent healing. As you can imagine, milder cases are a lot easier to correct than the more severe ones. The limiting factor is going to be how much of the normal lining is left inside the uterus. On the brighter side, the lining of the uterus is like grass, so it'll spread, but you do have to have kind of enough stuff in there for it to spread, right? Um, and so it is not impossible to take care of this. It might need a little bit of consistency, endurance, and patience, but as long as there is some normal tissue in there that we can help grow, then we can do the PRP and the balloon and the high dose estrogen to try to get it to spread out. Okay. And not because maybe the hysteroscopy might have failed, or might have, the adhesions reformed. That does not mean that it is that you can't go back in and try to fix it and then eventually have positive outcomes. As long as there is life, just remember there is hope. Okay. That was a second discussion I had today with a beautiful patient from South Carolina, because she was feeling a little hopeless. So her story is the following. She is 44, and she was working with another clinic, and unfortunately her BMI was more than the clinic allowed. And between the COVID and trying to lose the weight, and you know how time sometimes just slips between your fingers. Well, her AMH, she started this journey and she was 40, and her AMH at that time was 0.8. Not quite sure why it just plummeted. So her AMH now is 0.018. And she was a little devastated at those results. So we talked about donor eggs, and she's going to use donor sperm anyway, but donor eggs, and how sometimes we fear things that are in our heads. We don't so there are things that have not really happened. We're always fearing this worst case scenario, and sometimes things resolve so much better than we create this whole pictures of like the worst case scenario in our heads. And so I talked to her about some of the outcomes of the patients that are doing donor eggs, and 100% out of 100 of the women that I've been working with for the past several years, they say that if they had known how they would truly feel after becoming a mother through donor eggs, they would have made that decision a lot sooner, and that they did, because a lot of times their journeys were very rough getting to that decision. And understanding that hindsight is 2020. But sometimes, same thing with the cases that I'm talking about, the ladies dealing with intrauterine adhesions. Any challenge that you find in life, it looks definitely like a bigger mountain heading towards it than when you're leaving it behind. And a lot of times, I would say 100% of the times, all the fears that, that we create, we're creating it in our heads. We fear things that have not even happened and might never happen. So just remember, as long as there is life, there is hope, always. All right. I did an embryo transfer on the 17th, negative results on the 28th. Is there more success rate with waiting on embryo transfer back to back? I think that back to back is good. However, let's say if you're using donor eggs and you have 2 unsuccessful transfers, I would kind of stop and see what else are we missing. Are we missing chronic endometritis? Should we check on the uterus to make sure that there's nothing in there that shouldn't be there? There's different types of biopsy, including just putting on antibiotics to go through this. Are we dealing with adenomyosis? Are we dealing with endometriosis? Is there something else that needs to be addressed? And I've spoken before about the ERA, the endometrial receptivity assay, which for the majority of women, it'll show, that there's no issues, but there is a subgroup of women that need either more or less progesterone, and then that would benefit that group. So I would probably go ahead and just do some minor tweaking and do another transfer. If you've had 2 failed transfer with donor eggs, I would definitely stop and recheck all of this. Okay, I had 5 frozen embryos. I did 2 transfer with good lining, progesterone oil, da 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 da. 4 failed transfer. I am 41. What else can I do? You have 1 more left. So you've been doing this for 4 years. So it applies to you too, Natasha. What else, if you've been doing this for 4 years, that's a long time, and you have multiple transfers, that means that we have to stop and see your scenario from a different angles. What else are we dealing with? All the things that I mentioned, the endometritis, the endometriosis, the adenomyosis. Are we dealing with a disjunction of the progesterone and the lining? The effect of the progesterone and the lining is a little off. Should you do an ERA? Should you change to a letrozole trigger cycle instead of doing the medicated FETs? Should we look at your immune protocol? So I would go back to the drawing board and see what else could be done. Are we dealing with a genetic issue? Or, are we dealing with the recurrent pregnancy loss panel, a MTHFR or an antiphospholipid syndrome, so there's still things that we could look at before you do that one transfer. And like I was saying about, the life and hope scenario, I get the story very often of, heading towards that last transfer, that last embryo. But I need you to relax, because sometimes we put so much pressure, it's like that last fight, but it's not the last fight, because as long as there's life, there's hope. So you have to keep that in mind as well. Okay, great. Awesome. Okay, good. All right. Well, very good. I hope that you're all, like I said, we're having some good things happen. If we expect good things to happen, they will come. All right. So always keep, I call it, I had 2 IUIs today, and I said, keep it optimistically realistic. All right. So may you all have many blessings, and I will see you next week. And if any of you needs to chat with me for whatever reason, you can reach out to me through Messenger, and I will either answer within 24 hours or make sure that if you have a more complicated situation, you get on the schedule. All right. Many, many blessings and good night.